Glad you could join us. We're going to learn a lot this morning. We're going to cover a lot of ground in a very short time, and we're going to have a lot of fun doing it. The most fun that you ever had learning about prescription drug coverage. How about that? I call this prescription drug strategies for seniors. And we're going to talk about it in the context of Medicare, and we're going to break down some alternatives to Medicare whenever the need arises. So this is going to be stuff that you're going to wish that you would have learned 15 years ago, but it's going to serve you for the rest of your life. I'm an independent Medicare broker. This is not a sales presentation. This is an educational presentation. I work with Senior Health Services. If you're familiar with Senior Health Services out on 2920 West, you've probably driven by it before. Anyone here listen to the Michael Berry program? Yeah, we advertise on the Michael Berry program. So if you hear Michael Berry talking about Senior Health Services, that's who we are. So let's start out with a general overview of Medicare and where Part D fits into it. Y'all can remember D for drugs, right? Okay, so original Medicare is Part A and Part B. That's your hospital and medical insurance. I call that the apples in your Medicare pie. If you were going to bake a pie, an apple pie, you'd have to have some apples in your apple pie, right? You don't have apples in your apple pie, you got something else, but you don't have apple pie. Part A and Part B are the apples in your Medicare pie. You got to have that before you have anything else. Now, there's two different ways that you can get Part D coverage. One is if you have a Medicare supplement, also known as Medigap, then you're going to have a standalone Part D prescription drug plan. Anybody here got a standalone Part D plan? Okay, great. This is helpful. The other way is, this is the Medicare fork in the road right here. You only go one way or the other way. The other way is you have an Advantage plan, in which case your Part D coverage is bundled in with Medicare Part C. Who's got an Advantage plan? Okay, so we got about 2/3 Advantage plan here and about 1/3 supplement here. Now, these function differently. An Advantage plan is a replacement plan, and a supplement is a supplement. You stack it on top of your A and B. So your A and B stay in place. One of the big differences, and we're going to point this out later, between these two is that if you go with it on the supplement side, your health care is between you and your doctors. If you go with the Advantage side, then they have networks and they have referrals, and your health care then becomes between you and your doctor and your insurance company. And there's this thing called prior authorizations. And that's something you really need to be in tune with, because at that point, you've got an insurance company saying what sort of coverage that they're going to pay for. That comes into play in Part D coverage as well. So who is familiar with the term formulary? Oh, good. Do we have any nurses in here? Retired nurse? What kind of nurse were you?
Oh, Dolly, every time med surge in the last years, I worked surgery, day surgery.
Okay. So she's going to be your go-to person. She's going to know the answers to everything here.
Give me your phone number, will you?
Yes.
What's your name?
Pass it out.
What's your name?
Joy.
Joy. Okay, great. All right. For everyone else, a formulary is what your Part D drug plan covers. It's a list of the drugs that are covered and how they're covered. The easy way to think about this is like the menu at a restaurant. Every Part D plan has their own formulary of what they cover and at what prices that they cover them, how those drugs are covered. If you go to a restaurant, every restaurant has their own menu, right? You go to this restaurant over here, you got steak and lobster and shrimp. And you go to this restaurant over here, and you've got pizza and hamburger and hot dogs, and they've got their prices. It's the same thing. Every Part D drug plan, it doesn't matter whether it's bundled with an Advantage plan or it's a standalone plan, they all have their own formulary. Yes, sir?
I don't see it. I have an F plan.
A Plan F. Okay, so if you got a Plan F, you have a Medigap plan, a supplement, and you should have a standalone prescription drug plan in addition to that.
Amen.
Great. All right. So formularies are broken into tiers. And tier 1, tier 2 are generic drugs. And those are broken into preferred generics and non-preferred generics. Those are the ones that whenever you go to the pharmacy, they say, that's not going to cost you anything today, or it might cost you $5 or so. Not very much. We like that. Tier 3 and Tier 4 are brand name drugs. Now they're starting to get to be more expensive. And these are drugs that might retail for $1,000 for a 30-day supply. Yeah, they can be very expensive, but you go to the pharmacy and they say, oh, that'll be $47 for you today. That's pretty good insurance if you think about it. You get a $1,000 drug for $47. We like that. Well, that's all going to change. But this is how I want you to understand how this works for right now. Then we get into Tier 5 specialty drugs. Those are the ultra expensive drugs, like for maybe cancer treatment or autoimmune disease. And at that point, they just quit charging fixed copays and they say, oh, we're going to charge you some percentage of the cost of the drug, typically 25% of the cost of the drug. Now that you understand how formularies work, we're going to look at the other thing that all Part D plans share in common, and that is phases. They all have phases. And what I'm going to describe to you is what this looks like in the remaining months of 2024, because all of this is about the change. But understanding what this looks like right now gives you the backdrop to understand what the changes are going to be. So right now, there are 4 Part D drug phases. At the beginning of the year, on January the 1st, or when you enroll in a plan, you're going to begin in phase 1. That's the deductible phase. And you'll know you're in the deductible phase because you're paying 100% of the cost of your drugs until you reach the deductible for your plan. The most common deductible for a Part D plan in 2024 has been $545. That's total cost of drugs. You have to be $545 out of pocket before they begin to cover anything else. Once you reach your $545 deductible, now they can be less than that, by the way. There's drug plans that have $150 deductibles or $250 deductibles. Some even have $0 deductibles, but you pay more for those plans. Basic rule of insurance is that if they're giving you something with one hand, they're taking away something with the other hand. So if you get that really low premium plan, they're going to have the high deductible. If you get a high premium plan, they're going to have a low deductible. Once you reach your deductible, you're going to move into the second phase. That's the initial coverage phase. Now, that's where most people spend their time. Few people move beyond the initial coverage phase. That's where all of these copays apply. And you'll remain in the initial coverage phase until the total cost of your drugs for the year reaches $5,030. Now, that sounds like a big number, but that's the total cost of your drugs. That's not necessarily the cost out of pocket. That's how much you're paying and how much the insurance company is paying, full retail. If you reach $5,030, then you're going to move over into the third phase. That's the coverage gap, also known as the donut hole. That's why we have donut holes. We have 20 dozen donut holes over there. Y'all can have all the donut holes you want this morning. We're going to make those disappear.
They didn't come out of there, didn't they?
What's that? No. But we're staying with the theme. Now, when you're in the donut hole, anybody know why they call it the donut hole? No, but it changes the rules. So now, instead of paying these copays, you're paying 25% of the cost of your drugs. Ouch. Now, let me explain how this works out. Illustrate. Let's say that you have one of these drugs down here that costs $1,000 a month. I'm just going to use that number because it's an easy number to work with. The first time that you go to the pharmacy in January, you pay $545 and you satisfy your deductible, and the insurance picks up the difference, the other half of the drug pretty much. Then you go back the next month and you fill the prescription, $1,000. Each month that you go to fill it, that's $1,000 credited. You're only paying $47 though. Until about midsummer, you cross over $5,030. And you go to the pharmacy and they say, that will be $250 today. And you have the reaction that she just had. Whoa, wait a minute. What happened? You're now in the donut hole. So you're going to remain in the donut hole until the total cost of your drugs for the year reaches $8,000. Now, if that happens, you're having a really bad year or you have some very expensive drugs. That number's not quite as scary as it appears because remember, that's the full retail cost of the drug. That probably represents about $3,500 out of pocket. That's still a lot of money though. When you hit $8,000, then you move over into the fourth phase. That's the catastrophic phase. Sounds terrible, doesn't it? It's not that bad because then you're paying zero. The insurance is going to pick up everything else after that until the end of the year. You get back around to January 1st again, and then it starts all over again. You hit the reset button. Now, Murphy's Law says that that's going to happen at about December the 15th, right? These actuaries, they're not dummies. That's how it's worked until this year. It's all about to change. January 1st, 2025. Anybody heard of the Inflation Reduction Act? Yeah. Anybody's inflation been reduced lately? No. You can bet if they call it something in Washington, it's doing something else. So, Inflation Reduction Act has changed a lot of things. It touches a lot of different areas. This is the same legislation that got us 87,000 new IRS agents, right? Well, one of the things that it's doing is rewriting how Part D works. And it all started with somebody in Washington said, you know what? $8,000 is too much for people to have to pay for their drugs. So now we're going to make that $2,000. And those big bad insurance companies ought to have to pay for everything after $2,000. Well, you know what? They didn't ask the insurance companies what they thought about it. They just said, let it be written, let it be done. So what do you think is going to happen whenever the insurance companies now have to pay for everything after $2,000? A lot of common sense around here. Something's got to give. Yeah. Okay, so let's look at this. The one thing that we know is changing is that $545 now becomes $590. So we got a deductible going up. So about 2 months ago, the insurance companies started reporting back to Washington that, guys, in order to do that, we're going to have to raise our rates. And
Well, who sponsored that bill?
we're not going to talk about it.
Free.
Yeah.
I won't vote.
Voting starts today over at the Public Utilities Building. So okay. 590 insurance companies said rates are going to go up. Premiums are going to go up. And someone in Washington said, you know what? There might have been some unintended consequences to changing this to $2,000. We can't let that happen. Insurance companies, you can only raise your rates this much. Not up here. You raise it this much. So they squeezed them again. So the rates are going up, but now something else has got to give. What do you think is going to give? Yeah. Are my drugs still on the menu? Where are they on the menu? What do those copays look like? Now that's this stuff, the premiums and your deductibles, those are the things you're paying attention to when you're enrolling. You're not really looking at this stuff down here. You guys will be because you're going to know. Pay attention to this stuff. But most people won't notice that until January 1st when they get to their pharmacy and they say, oh, your drugs aren't covered this time, or they're covered differently than they were before. And at that point, it's too late. Right now, starting last week, we're in the annual election period. Y'all all know that because Joe Namath has come back on your television. So this is your window of opportunity. If you need to make changes to your Part D coverage, this is your time to do it. It doesn't matter if you have an Advantage plan or standalone Part D plan. You need to have your Part D drug coverage reviewed this year between now and December the 7th without fail. And if you got friends that are on Medicare, and I know you do, they all need to have their prescription drug coverage reviewed without fail, because 73% of the people who are on Medicare are going to be affected by that. That's a lot of people. Now, if everything is good, you're going to sleep better at night knowing, oh, my coverage is good. Somebody has checked this for me. If it's not good, then now's the time to make the changes, and it could be a big deal. Let me tell you, I had a lady last November. She was coming to Texas from California, her 65th birthday, and her sister referred her over to me. She had a cancer diagnosis. And she said, what can you do? I talked to her and I said, you know what? No one would ever want you to have cancer, to get cancer. But in the Lord's mercy, this is happening on your 65th birthday because you're about to get the best insurance that you've ever had in your life. We put her onto a Medigap Plan G and a standalone prescription drug plan. And I talked to her. I've kept up with her since then. I talked to her a couple of months ago. And she said, Rodney, I want you to know, everything that you told me about that Medigap plan was true. I paid a $240 deductible the first time I went to the doctor. I have had chemotherapy. I've had radiation. I've been back to the oncologist time and time again, and they've never asked me for another dime. That's powerful. Be careful about this. There's no such thing as free. When the chips are down, that matters. One thing did go wrong, though, and that was that she was tight on money, and she said, I'm only taking 2 generics. Can I get a cheaper drug plan? Absolutely. I'm all about helping you save money. So we put her on a very inexpensive drug plan, cheapest one we could. And it worked fine for her until the first time that she visited the oncologist's office, started her chemotherapy, and they gave her an injection, cost $5,000. Guess what? Wasn't on the menu. So here's the moral of that story. If you know that you've got a procedure coming up, like she did, go to your doctor. Doc, this is not your first time to take this course of treatment for somebody. What do you think that you're likely to prescribe to me over the next year? Get the list. They'll give you the list. And bring that list to your trusted independent Medicare broker. We're going to put that into a computer, all the drugs that you're taking, put in your zip code in there. We're going to look at all the plans side by side. And we're going to, all of these variables, all these moving parts, like the deductibles and the copays and the premiums, all of that, we can model that out and say, over the course of the next year, if you're taking these drugs and you're buying from pharmacy A, pharmacy B, pharmacy C, this is what your drug costs are likely to look like. And that way you can make informed decisions about what is the best plan for you. It doesn't have anything to do with the color of the logo or the brand name or anything like that. It has to do with what plan covers you the best, your own unique drug needs, because everybody here has got something that's different. Now, there are some things that are not covered by Part D. And what I provided for you is a laminated sheet. If y'all throw away everything else that you got today, you keep that. On the back side of that sheet, you're familiar with GoodRx, right? Everybody know what GoodRx is. Okay, sometimes it makes sense to buy your drugs outside of your Part D plan because they're not covered very well. What happens if your drugs aren't on the menu? Okay, don't freak out. There's options. You can go outside of your Part D plan. You're not going to get credit for those drug purchases, but you can. It's legal. Go through GoodRx, shop it around. There's some other plans that are kind of like GoodRx. They're listed on there. Another way that you can save on your drugs, you'll see there's a list of mail order pharmacies there. Anybody here use a mail order pharmacy? Yeah, get 90-day supplies. A lot of those mail order pharmacies, now don't go for any flim-flam mail order pharmacy out there. A lot of those mail order pharmacies are owned by the same companies that have the brick and mortar pharmacy on the corner. So that list that you've got right there is a list of safe pharmacies if you want to shop this around at mail order pharmacies. There's also a list of certified Canadian pharmacies there. Key word there is certified. Anybody here used a Canadian pharmacy before? Oh, wow. Okay, so this is between you and your doctor as to whether or not you go that route. But sometimes it might make sense. Anyone here taking Eliquis? Okay, or you know what Eliquis is? Yeah, Eliquis, blood thinner. It's expensive. That drug, it's one of the ones that's supposedly been negotiated down, but it has been running about $600 for a 30-day supply. That's one of those drugs that you're getting filled for $47. I looked on the certified Canadian pharmacies for Eliquis. I found 90-day supplies of Eliquis for $170. So if I was prescribed Eliquis, I would be going to my doctor and say, hey, doc, can we do this? And my doctor might say, nope, I'm not writing a prescription to a Canadian pharmacy. Can't do it. But I can write the prescription and give it to you, and you can FedEx it to them, and if they'll fill it for you, then we're all good. So I just want you to know there's conversations that you can have with your providers to work through some of this stuff. Sometimes you might get coupons, or you might get manufacturer discounts if you ask your doctors about these things. Yeah.
I don't know if other people know about this, but like Walmart has some drugs on the $4 plan, and so does Kroger. And that has saved me a lot, because one of my prescriptions can be quite expensive, but I can get it for $4 if I go to Walmart, or $10 for a 90-day supply.
Mm-hmm. Talk to your pharmacies.
People don't know that.
Yep. Talk to your pharmacies. Here's categories of drugs that are not included. Entire categories. So if you know these things, you can just anticipate this up front. Part D, this is not listed up here, but Part D does not do a very good job of covering things like inhalers, nasal sprays, eye drops, creams. Those things are typically, you're not going to get favorable treatment with a Part D plan. Those are the kinds of things you're probably going to want to go outside of the plan for. Other things, barbiturates are not included in any Part D plan because of the potential for abuse. Benzodiazepines. Now, Steve saw, I wrote that up there without looking at my notes. Those are the anxiety drugs. Cosmetic drugs and hair loss drugs. Guys, look, some of us were out of luck.
That don't work on your hair, though.
Nope. Fertility drugs. Look, we're all over 65 here, okay? Sexual dysfunction, we're not going to talk about it. Vitamins and minerals, even if they're prescribed, they're not covered by Part D. A lot of times your doctor will prescribe vitamin D or iron. Yeah, those aren't, even though they're prescribed, they're not going to get paid for by Part D. Non-FDA approved drugs, they're not going to do anything experimental. It's got to be approved. Weight loss and weight gain drugs. Now look, at our age, very few of us need weight gain drugs. But weight loss drugs, I get asked the question at every class I teach. So we're going to talk about it. What about Ozempic? What about Wegovy? Here's the deal with Ozempic and Wegovy and all of those that fall into this class of drugs. These are the same stuff. Different dosages, but they're the same stuff. GLP-1 drugs, semaglutide. They're even manufactured by the same company. It's a Danish company called Novo Nordisk. Different dosages again, but same stuff. But they're labeled differently. Now, we've got this list of Part D exclusions. The exception to the exception is when a drug is prescribed for another medically accepted purpose. Ozempic is labeled for blood sugar management. So how do people get Ozempic? They go to an endocrinologist and they do a blood sugar test. And they say, oh, your blood sugar is out of whack. We're going to prescribe for you Ozempic, which has the side effect of helping to manage weight. Wegovy is labeled for weight loss. And therefore, Ozempic gets paid for, and Wegovy does not. So they're trying to, a couple of months ago I read, they're trying to get Wegovy approved for certain coronary diseases. If that happens, that will change how it's treated. But this is a big deal because these are super expensive drugs. Retail on these is about $10,000 a year. Yeah, so that's a really big deal, whether or not they get covered and how they get covered. But now you got the inside scoop on Ozempic. You guys are going to know more than all your friends. So remember, we were talking about prior authorizations over here with the Advantage plans. Same thing can happen with Part D drug plans. Remember, the insurance company is paying for it. So the insurance company might say, hey guys, before we agree to pay for that expensive drug, we would like you to make the case that it's medically necessary. So one variation of that is called step therapy. Anybody ever heard of step therapy besides Joy, the nurse? Okay. You're going to recognize it whenever I describe it to you. You just didn't know what to call it. Step therapy is when there are 3 different medications that could be prescribed for a particular condition. Drug A, drug B, and drug C. Your doctor would like to prescribe to you drug C. And the insurance company says, no, we're paying for that. We'll let you prescribe drug A. Try that for a while. And if that doesn't work, then we'll consider drug B. And if that still doesn't work, then we'll consider drug C. So you see that step therapy. So this is one of those cases where having a good doctor can really make a difference. Having a doctor that will advocate for you. Doctors can go to these insurance companies and say, maybe your drug is not on the formulary. I need a formulary exception. Park that thought in the back of your mind. Formulary exception. Or maybe it's on an expensive tier on the formulary. And the doctor goes to the insurance company and says, hey, I've got a patient that really needs this drug, but they can't afford it. Can we move this from a tier 4 to a tier 3? And that's having a good doctor can really make a difference there. So, yeah.
Is that only on, like if you have A and B with the drug plan, or does that happen also on your Advantage plan? I'm kind of getting confused on some that I'm thinking, well, I haven't seen that on my Advantage plan, so I don't know whether I don't know which.
It applies the same way.
Oh, yeah.
Yeah, regardless of whether you have Part D coverage bundled in an Advantage plan or you have it as a standalone plan. Part D works the same way. Okay. There's just 2 different ways of getting it. So now on the information that I handed out to you, there's a yellow sheet there. If you would like help with this, a drug review, I'm happy to do that for you. It will cost you nothing it will never cost you anything to have my help. And we can look at it, make sure everything looks good. If something looks like you might want to get it dialed in, I'll let you know. You can decide how you want to treat it from there. But I'm happy to help you. Put your information on there. Let me know. Hey, talk to me about this in 2 days or 2 weeks. If you don't ever want to hear from me, you don't have to fill it out. Or fill it out and say, I don't ever want to hear from you. You'll never hear from me. Last thing in the world I want to do is call somebody who doesn't want to hear from me.
Be nice about it.
Yeah. I'm here for you if you need help. That's the point.
Thank you. You are explaining it very clearly. I appreciate it.
Good. That's what we want. Do we have questions? Okay. Another thing is I'm going to be over at Gloyer Pharmacy next Monday and Tuesday. And depending upon how that goes, we may do that for a while. I talked with them this morning. I'm going to set up a table just off to the side of the pharmacy. If y'all would like to come by, we can look at the stuff. I'll bring my laptop with me. I'll bring my little laminating machine. So if you've got a red, white, and blue card that's getting kind of soggy in your wallet or your purse, I'll laminate it for you and answer questions for you. By the way, Gloyer Pharmacy, it's not a commercial for them, but I'll just say, what a treasure.
They have been here forever.
They have been. And I have wondered, one of those places that, you drive by them 1,000 times. And I have wondered how they stayed in business. You got CVS across the street and Walgreens and HEB down the street. And I mean, everybody around them. And the first time I walked in there, I realized instantly how they stay in business. Because the ladies at the front desk were greeting people as they came in. Hello, Mr. Smith and Mrs. Jones. They knew everybody that was there because they'd been coming there for decades and they're not going anywhere else. And you know what? How refreshing it is when you go up to the pharmacy and there's somebody there who can give you guidance, come alongside and give you guidance. You're not waiting in a long line, but you walk up there, they know you, they're there to help you. They don't have purple hair and a nose ring. You know, it's great. It's great. What a treasure. What a treasure. It is always busy. And you know what it reminded me of? I grew up in Conroe. My dad was the mayor in Conroe until the day he died. And we had places like that in Conroe whenever I was growing up. And it was just like, I'm at home. Any other questions? Yeah.
It made me think.
Good.
I found a, what's in this? When I wanted to decide where to have my prescriptions filled, I think had to go to my Part D website and say, this is where I want to go.
Mhm.
It's approved.
Okay. Is that true?
Yeah, so there are two different kinds of pharmacies with all Part D plans. There are standard pharmacies and there are preferred pharmacies. You're going to get the better deal at a preferred pharmacy. So if I'm helping you with something, I'm going to ask you, where do you like to get your drugs? Where do you like to get them? And you're going to give me a list of 2 or 3 places, and we're going to line them up side by side and say, oh, you know what? HEB is the cheapest place to get my drugs filled. Or this online pharmacy is the cheapest place. And it may be that some things are cheaper at one place and some things are cheaper at another place. And in that case, we're really going to focus on the problem drugs. Yeah, because a lot of the drugs that people are prescribed are these tier 1 and tier 2 generics, and it's not going to matter where you get those from. They're going to be cheap no matter what. But if you get into the tier 3 and tier 4 drugs, now they're going to get expensive. By the way, you're going to hear talk. We didn't finish with what happens here. So if this catastrophic threshold becomes $2,000, all of this shifts this way. So you're hearing talk now of the donut hole is going away. Well, half truth. What they call the donut hole is going away. What's happening more realistically is that the donut hole is shifting over here into the initial coverage phase, because a lot of these plans that had fixed copays before are now going with a percentage of the cost of the drug in tier 3 and tier 4. That's where they're starting to get expensive. It's those brand name drugs that you got to watch out for because they can get very, very expensive. So this is just shifting this way. So if you've got really expensive drugs, you got a $1,000 drug that you're taking, this is going to be great for you because you're going to go in month 1, pay for your $590 deductible. The insurance picks up the rest. Month 2, you go in, and if you had to pay 25%, you're paying $250 for that $1,000 drug. But by springtime, you're in catastrophic. Everything's paid for after that. All of your drugs are paid for after that. You're going to be like, hey man, don't give me the generics anymore. I want the good stuff because everything is paid for. If you got expensive drugs, this is going to be really groovy for you. If you're the kind of person that only takes a couple of generic drugs, it's kind of a drag because you're carrying the weight for everybody else. Any other questions? Great. I'm glad y'all came. Hope it was worthwhile. And if you need my help, my phone number's on the pen. Hang on to that. Might feel like gold in your hand at some time.